Every surgery has risks, and it's important to understand what they are before moving forward. The good news is that only about 5% or less of individuals who have surgery actually experience any complications after a hip or knee replacement. Now, even though they're uncommon, they can happen, and some of the more common complications that happen include infections, bleeding, injury to nerve or blood vessels, and delayed wound healing. Now, it's important to realize that we can reduce the risk of these complications by doing things before surgery, like optimizing your health, controlling your diabetes, making sure you stop smoking, reducing alcohol risk, or decreasing narcotic medications are some of the tools that we use in order to decrease the chances of you having any complications in the first place. Another thing that we try to optimize is weight loss, which can also be a risk factor for complications. A big thing in our group that we like to emphasize is that this is a team sport, right? And we're gonna do everything on our end to ensure that you have a good outcome, but we also have to make sure that you do everything on your end to ensure that we have a good outcome as well.